Hello and welcome. Today we're delving into the world of ophthalmology to explore a condition known as solar retinopathy, also sometimes referred to as sun retinopathy or solar maculopathy. This is a potentially sight-threatening condition caused by staring directly at the sun or other intense light sources without adequate eye protection. Join us as we uncover its causes, symptoms, diagnosis, and what you can do to protect your precious vision. So, what exactly causes solar retinopathy? The culprit is intense light energy focused onto the retina, the light-sensitive tissue at the back of your eye. When you look at the sun, even briefly, the lens in your eye acts like a magnifying glass, concentrating the sun's rays onto a very small area of the macula. This part of the retina is responsible for central vision, and its delicate cells are easily damaged by the overwhelming energy. Eclipses, religious practices, and even certain recreational activities like sunbathing without proper eye protection can all lead to solar retinopathy. Let's understand what happens at the cellular level. The intense light energy generates excessive heat and photochemical reactions within the retinal cells, particularly the photoreceptors. These photoreceptors, responsible for converting light into electrical signals that the brain interprets as vision, become damaged or even destroyed. This damage leads to swelling and disruption of the retinal pigment epithelium, a layer that supports the photoreceptors. Ultimately, this results in a localized burn or lesion on the macula, impairing its function. Solar retinopathy isn't a widespread condition, but its occurrence tends to increase during solar eclipses or times when individuals are deliberately gazing at the sun. Certain demographics might be at higher risk. These include individuals with psychiatric conditions, children who may not understand the dangers of sun gazing, and people participating in cultural or religious practices that involve sun worship without proper eye protection. Understanding these at-risk groups is vital for targeted education and prevention efforts. Now, let's talk about the signs and symptoms. Often, individuals with solar retinopathy will notice blurred or distorted central vision. They may experience a central blind spot, known as a scotoma. Colors might appear faded or altered, and difficulty reading or seeing fine details is common. Headaches, eye pain, and sensitivity to light, or photophobia, can also occur. It's important to note that symptoms may not appear immediately after sun exposure, and can develop gradually over several hours or even days. Diagnosing solar retinopathy requires a thorough eye examination by an ophthalmologist. This includes checking your visual acuity, assessing your color vision, and examining your retina using specialized instruments. Optical coherence tomography, or OCT, is a non-invasive imaging technique that provides detailed cross-sectional images of the retina, allowing the doctor to visualize and assess the damage to the macula. Fluorescein angiography, which involves injecting dye into the bloodstream to highlight retinal blood vessels, may also be used in some cases to rule out other retinal conditions. While solar retinopathy doesn't typically have formally defined classifications or types, the severity of the condition can vary significantly depending on the intensity and duration of sun exposure. Some cases may involve mild, temporary vision disturbances, while others can result in permanent vision loss. Unfortunately, there is no specific or universally effective treatment for solar retinopathy. The primary approach is supportive care and observation. In many cases, the condition improves spontaneously over weeks to months as the retinal cells heal. However, some patients may experience persistent vision impairment. In certain situations, medications such as corticosteroids may be considered to reduce inflammation, although their effectiveness is not definitively proven. Low vision aids, such as magnifiers, can help individuals cope with any remaining vision loss. The most effective way to manage solar retinopathy is through prevention. Never look directly at the sun, even during a solar eclipse, without proper eye protection. Certified eclipse glasses or viewers that meet the ISO 130-12-2 International Safety Standard are essential. Regular sunglasses, even those with UV protection, are not sufficient for direct sun viewing. Educate children about the dangers of sun gazing and ensure they understand the importance of using proper eye protection. During activities where intense light exposure is possible, such as welding or tanning, always wear appropriate protective eyewear. The prognosis for solar retinopathy varies. In many cases, vision improves significantly within a few months, although some residual visual disturbances may persist. In more severe cases, permanent vision loss is possible. Recent research is exploring potential therapies to promote retinal regeneration and protect retinal cells from damage. These include studies on neuroprotective agents and cell-based therapies, but these are still in the early stages of development. Ongoing research holds promise for improving the long-term outcomes for individuals affected by solar retinopathy. Thank you for watching, and remember, protecting your eyes is crucial for maintaining your vision.